Jason Martinez here in the Fox 29 newsroom. We're about to receive an update from Philadelphia's health commissioner. That would be Dr. Cheryl Bettigole on COVID-19. The big question we're all waiting to find out is, will a rise in cases mean the indoor mask mandate is back in the city of Philadelphia? Let's listen in. Dr. Cheryl Bettigole.
Representative asks questions, and that we limit questions to 2 or fewer. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it. We will begin our briefing with opening remarks from Health Commissioner Dr. Cheryl Bettigole. Dr. Bettigole, you have the floor.
Good afternoon, everyone. So I'd hoped we wouldn't be meeting like this again, but here we are. On February 16th, we established our COVID response levels. These response levels were intended to show Philadelphians what was happening with the pandemic and transparently tie our response to that. The idea was that if the pandemic was getting better and cases and hospitalizations were going down, we should lift some of our mitigation strategies. If things got worse, we had the ability to put strategies into place that would help slow the spread of COVID. Shortly after we announced the response levels, things did get better and we were able to move into the all clear level. We could choose to go into businesses and institutions without masks and dine out without checking for vaccination. It was wonderful to feel that sense of normalcy again. But recently, we've been watching COVID-19 cases and hospitalizations rise in several European countries and in some places in the US. And now we're starting to see cases here in Philadelphia rise. This looks like we may be at the start of a new COVID wave, like Europe just saw. Today, we're reporting that we're averaging 142 new cases every day. Today's case count is more than 50% higher than what we saw 10 days ago, so we know that cases are rising fairly quickly. The number of people hospitalized in Philly with COVID is still low, only 46. So today, I'm announcing that we have reached the threshold for moving out of the all-clear COVID response level and into the mask precautions level. Simply put, that means that we're reintroducing the mask mandate in Philadelphia. We'll have a 1-week education period to allow time for us to get the word out. We hope that by having folks masked up whenever they're in public indoor spaces, we can get ahead of the wave and keep it from reaching a peak like we saw in January with the Omicron variant. If we can do that, we can literally save the lives of vulnerable Philadelphians. At this level of transmission, we do not believe that there's any reason to panic or to avoid activities we enjoy and that are important to us. Our city remains open. By wearing masks consistently, we can continue to go about our daily lives and continue to take part in the life of our city without contributing to increasing transmission of COVID-19. The Omicron wave took the lives of nearly 750 Philadelphians in the span of about 3 months. We have great tools now to fight this pandemic in the form of vaccines, antiviral medications, and we know more about how to prevent and treat the infection than ever before. And yet, 750 people in our city died from a variant that was milder than previous variants, but that spread across the city like wildfire. Omicron caused about 1/3 to 1/2 the risk of hospitalization compared to the Delta variant. However, at peak, Philadelphia had more than 3,500 cases of Omicron per day, more than 3 times our peak in previous waves of the pandemic. We don't know if the BA.2 variant in Philadelphia will have the kind of impact on hospitalizations and deaths that we saw with the original Omicron variant this winter. I suspect that this wave will be smaller than the one we saw in January. But if we wait to find out and to put our masks back on, we'll have lost our chance to stop the wave. If we mask up now and find out that hospitalizations don't increase in the US in response to this variant the way they have in the UK, then great. We can then take off our masks with a sense of relief. But if we fail to act now, knowing that every previous wave of infections has been followed by a wave of hospitalizations and then a wave of deaths, it will be too late for many of our residents. This is our chance to get ahead of the pandemic, to put our masks on until we have more information about the severity of this new variant, and to choose to protect each other as we have throughout this pandemic. Starting today, I'm asking all businesses and institutions in Philadelphia to dig up those old mask-required signs and start hanging them in your windows. Start having conversations with your staff about reminding people to wear their mask while they're indoors. We'll be reaching out through all of our channels to let businesses know that the mask mandate is back. I'm also asking each of you, the residents of Philadelphia, to dig out your masks again. Make sure you have them when you leave the house and start getting back into the habit of wearing them when you're indoors in public places. Then, beginning Monday, April 18th, our health inspectors will begin enforcing the mask mandate again. We'll be watching hospitalizations carefully over the next few weeks to see if they rise, as they have done with other waves of the pandemic. If we start to see a different pattern than that of previous waves of the virus, we'll review our metrics to see if there are opportunities to be less restrictive. I sincerely wish we didn't have to do this again. I wish this pandemic was over just as much as any of you. But I am very worried about our vulnerable neighbors and loved ones. It's my hope that our actions today will slow the spread of COVID and help us avoid seeing our ERs once again get so crowded that people can't get timely care when they need it. The best thing that all of us can do to protect ourselves and each other is all the things we know so well. If you aren't up to date on your COVID vaccinations, get caught up today. You can find vaccine clinics at phila.gov/vaccine. Wear your mask every time you're indoors in public. While we're not enforcing the mandate until next week, we can help stop the spread today by doing that. Stay home if you're sick, and if you're feeling sick, get tested. There are resources on phila.gov/COVID for finding free at-home tests and information on testing sites on phila.gov/testing. It's a good idea to keep some tests at home so that you can use one easily if you aren't feeling well, or before visiting someone who's elderly or immunosuppressed. And if you have questions, please call us at 215-685-5488. Thank you very much for helping to get all of us through this difficult time.